Hello, and welcome all to the third and final day of the U.S. National Academy of Medicine's workshop, the How of Systems Transformation, Strategies and Levers for Health-Centered Climate Action. I am Michele Toplitz, the Program Director of the NAM's Initiative on Transforming Systems for Climate and Health. As you may know, this is the second workshop in a three-part series exploring how we can reorient systems to place health at the center of climate action. Thank you, everyone who is joining us today, including our speakers, commissioners, and the public audience. We look forward to continued discussions, which today will focus on governance, policy, and legal tools as potential levers for change. Next slide. Before we begin today's program, a few quick housekeeping items. Today's session is being recorded, and the video and presentation materials will be shared on the NAM website in the coming days. We hope members of the public audience will actively participate by sharing reflections and submitting written questions in real time for our speakers. To do so, we encourage you to use Slido, our live Q&A platform. It's simple to access. Just enter your name, check the box, and click Join Slido. Once in, the blue bar below the video player will give you access to submit questions and view others' questions. Each session today has time set aside for Q&A, and we'll aim to address questions as time permits. And now I would like to introduce the President of the National Academy of Medicine, Dr. Victor Dzau, who will offer reflections on days 1 and 2 and tee up today's session. So Dr. Dzau, over to you.
Thank you, Michele, and good morning, good afternoon, and good evening to all who are joining us from around the world. First, I want to begin by warmly welcoming everyone back to the final day of our virtual workshop on the how of systems transformation, strategies and levers for health-centered climate action. It's wonderful to have you with us again for what promises to be another insightful and action-oriented set of conversations. You know, over the last 2 sessions, we've seen the community of leaders, researchers, and advocates wrestle with some of the deepest structural questions underpinning climate and health systems. And just as importantly, service promising levers for change. In part 1, we explore the foundational question, how does system transformation actually happen? And we ask, what are the core levers we need to mobilize? And how can health serve not only as an outcome, but as a connective tissue that catalyzes change across all the sectors? So we heard from powerful insights on the need to move beyond technical fixes, to resource cross-sectoral collaboration, and to be honest about trade-offs, and to invest the relationships and trust that we must make to make transformation work. We also dug deep into 2 metrics, not just to measure progress, but to move system. As we heard, metrics matter when they are embedded in decisions, when they shape what gets funded, what is held accountable, and how do we value health in the climate equation. You know, I was struck by the emphasis not only what we measure, but how, especially when it comes to inclusion, equity, and lived experience. And yesterday in part 2, we built on this by turning the spotlight towards value and finance. Ask what gets counted, what gets funded, and why. We heard that, in fact, these are really important issues and that there's reflections on the mismatch between what communities prioritize, that is well-being, prevention, equity, and what our current economic models and financial systems actually incentivize. So we need to be connecting those pieces. You know, last week, I spoke at the Global Conference on Climate and Health in Brasilia that's leading up to COP30. And the focus of that meeting was the Belém Action Plan, which they put forward for COP30, focus on health and climate. And you know, the themes of our workshop echoed across every session have participated in, the world is realizing that unless we foundationally shift how we define our value and how we mobilize capital around that value, we'll continue to be underinvesting in the very solutions that matters most. What this workshop has reinforced is that the systemic transformation isn't just about ambition, it's about architecture. And the architecture is legal, financial, cultural, and deeply political. So that brings us to today, part 3, where we'll drive into two most critical dimensions of architecture, governance and policy. And we have some of the best speakers and experts talk about this. So this slide shows you the agenda. First in the morning is governing for system change, and will serve as examples of multi-level governance, from national task force to regional frameworks. And that has successfully aligned health and climate agendas. These examples will help us distill what makes governance durable, inclusive, and fit for purpose in the service of crisis and complexity. Then we're going to move into policy and legal levers for system change. Session that will explore how legal and regulatory tools can embed accountability, shift incentives, and enable cross-sectoral action. As many of you know, laws don't just reflect systems, they shape them. Understanding where and how they've been used to unlock transformation will be essential to the Commission's work that we are all undertaking. Next slide. So before we get started, I really want to take a moment to express my deep gratitude to our outstanding planning committee, which is shown here, for curating such a thoughtful agenda. And of course, I want to thank my staff, Michele Toplitz, No Duff, and Victoria Nichols, for behind-the-scene work that make these conversations possible. And of course, thank all of you, the speakers today, our commissioners, and all the participants for your active engagement. Your insight will help shape the Commission's forthcoming work in ways that are rigorous, grounded, and importantly, actionable. So with that, let's move to our first session of the day. It's my pleasure to introduce our moderator, Akenji, Executive Director of Hot or Cool Institute, and a commissioner with the NAM initiative. Louis, thank you for leading what I know will be a dynamic, important conversation. Over to you.
Thank you so very much, Victor, and good morning, afternoon, evening to everyone who is joining us. I'm pleased to be moderating this session on a topic which I think you realize is both foundational to climate health action and really very timely. As Victor mentioned, laws are important. Institutional arrangements are at the heart of governance. Because think of it, institutions are custodians of our values and norms. They set the rules of the game and determine how we act. So it's not a strange thing to anyone here that today we're faced with overlapping crises, health inequities, ecological degradation, loss of public trust, and increasingly governance systems and old institutional mechanisms find that practically they're no longer fit for the times. They're being stretched beyond their limits. And in the emerging health and ecological realities, they find themselves sort of wanting. Yet let's imagine that within this destabilization lies a crucial opportunity, the opportunity to rethink and renegotiate the rules of the game and the institutions that will guide us towards a healthy and sustainable future. We need to, and we are in fact, in the process, as many of these cases here would show today, of establishing new governance approaches, including retiring some of the old institutional arrangements and setting up new mechanisms. Governance at its very core is about how we organize ourselves, how we align decision-making, distribute resources, and hold each other accountable. And in this moment of accelerating change, our existing governance models must really just evolve to match the scale, urgency, and complexity of the challenge that we have before us. we need to shift from primarily economistic thinking to designing new provisioning systems for healthcare, setting new regimes for patents and intellectual property, and to engage different actors and the public very differently. That's why this session is going to go deep into exploring how different governance and innovation approaches at a national level, sub-national level, and continental levels are enabling more integrated and inclusive health, climate health action. You immediately recognize the privilege I have to moderate this panel because we have exceptional people. We have Dr. Kaseya, who is Director General of the Africa Centers for Disease Control and Prevention. We have Susana Muhamad, who is the former Minister of Environment and Sustainable Development for the Republic of Colombia. We have Nuin-Tara Key, who is Executive Director of Programs at California Forward, which is a multi-partisan organization working to build a sustainable and resilient economy for California. But perhaps I would like us to have a much more interactive conversation than just sitting and listening. And to get us started with the conversation, I'd like to invite each of the three distinguished panelists to share a brief reflection on why governance at this point really matters in the case of climate health action. Just one or two sentences. And in the last few minutes, we've had note that His Excellency Kaseya cannot join us. So he is being represented by Dr. María, who is also a colleague of his. So María, may I please start with you?
Yes, thank you. Thank you, Luis. I hope you can hear me clear. All right, yes, thank you very much. Really, governance leadership really matters, particularly in our context here in the continent where we have been struggling with so many extreme weather events as well as expansion of disease outbreaks across the continent. Governance, leadership, ownership of this subject matter is really important to pave the public health actions moving forward in collaborative and one health approach across different sectors.
Thank you, and I'm glad you have a case study to demonstrate exactly this. Susana?
Thank you. We have to understand that climate is an issue of public health and requires prevention. But in a new environment, it is an environment of uncertainty. It is an environment of a situation which is dynamic and permanently evolving, and we will need to create the capacities to foresee, prevent, react. And it happens from the ground to the government levels. We don't have time for bureaucracies. It is a time for connection. And I agree with Dr. Morawi with collaboration. And that requires new thinking of governance models in the climate change era.
Speaking very much from experience. And Nuin-Tara?
Yes, thank you so much. Exciting to be here today. I think building on what Dr. Morawi and Susana shared, I think governance is really important in this moment in time as we think about, not just climate adaptation and responding to the impacts, but also what it takes to build true resilience in the face of managing the uncertainty that Susana mentioned. And that managing and building resilience is a process. It's not a static outcome. And so in the governance context, I think it's really important to recognize that our governance systems also need to be able to be adaptable to this evolving kind of process, because it's not just what we are planning for that needs to change, but also how we are doing that planning.
Thank you so very much for those initial inputs. And it also demonstrates why I'm so excited about this panel and your spotlight presentations, which we'll now turn to. And I know that each one of you is offering a different vantage point on how governance can unlock climate health action, starting with a broad continental level to the national level, and then to a sub-national level. I will go with the first case right away, which is the going to Africa. the Africa Centers for Disease Control and Prevention has what it calls a Climate Change and Health Strategic Framework, launched just last month, which shows how high-level political commitment anchored in One Health approaches can unify sort of countries around a shared governance model to drive coordinated action. For this, I would invite, on behalf of His Excellency Kaseya, I would invite María to do his presentation.
You're muted.
Sorry. Thank you very much, Luis. I will walk you through the context we are in and what the Africa CDC and the African continent are trying to come up with on climate change and health perspective. Maybe next slide. So as you may be aware of this slide, we are at, from the global context, we are at the lowest resilience point of view from the global health systems point of view. As you can see, it's significant amount of sub-Saharan region are low or no resilient for climate change impacts and compared to the rest of the world. Next slide. So this is the realities we are in. We usually struggle between extreme weather events, drought in one place, another flood in another place, and the same vulnerability we have across the continent. And it is a really dynamic and very uncertain environment that we are navigating in with very limited health resilience capacity across. And this is not only for now, it is for the coming years, it is going to really subsequently cost us a lot, both financially, economically, as well as the lives and livelihoods across the continent. Maybe we can pass the slide next. So what is that Africa CDC trying to come up with? So we have been struggling, and public health as the core of this, and as all our vulnerabilities are there, Africa CDC tried to come up with a climate change and health strategy to mainstream the concept across different political structures in the continent, from the health sector into other sectors like the animal health sector, as well as the environmental sector. So recently we launched a climate change and health strategy based on One Health approach. And we have critical key priority areas that we identified as a continent. Next slide. So as we identified here as critical areas as priority areas for intervention includes governance and leadership, public health emergency and disaster response, innovative financing, research and innovation and data, capacity building, risk communication and community engagement. With overall sense of this is to have focused with mitigating the health impacts of climate change across the continent, and to reduce our vulnerabilities and to save our livelihood across the continent. And this is a strategic framing that we put as Africa CDC at high level, where we engage member states across the board, 55 African Union member states, to really prioritize and act around these pillars of intervention. Next slide. So one of the pillars is governance and leadership. Under this, we include one is to include health in the nationally determined contributions of in each member states. And the other one is capacity building for ministers of health, and create a climate and health training curriculum, provide technical assistance to strengthen ministers of health capacity to develop, monitor, and evaluate climate health policies. The other one is multi-sectoral coordination. Climate is cross-cutting, and we establish a climate and health working group, hold quarterly coordination mechanisms, and develop guidance for integrating climate and health concerns into the national health system. The other areas that we flagged here under governance and leadership is international cooperation and advocacy, prepare advocacy briefs, support participation in international climate events, and facilitate partnership to promote health in the climate policy discussion. And finally, under this pillar, we put domesticating the climate health strategy and provide technical support and toolkits to help member states integrate the climate health strategy framework into the national health policies. These are key aspects of governance and leadership that we flagged in our strategic document as we are engaging and advocating, taking advantage of our presence being in the African Union and the main political institution of the continent. Next slide. So all this really will adapt into One Health approach and to create synergies that we all aspire and every sector to come together and address this in unison. So that is the way we make this arrangement in One Health approach. Next. Yeah, that is in brief what we are really trying to do in the continent. But I will invite here everyone to look at the Africa CDC Climate Change and Health Strategy for in-depth review. Thank you very much. Back to you, Luis.
Thank you so very much, Mary. It's nice. Some of the data you showed is just scary, but it's also nice to see that the CDC is rising to the challenge here. Shifting now to national level and speaking from experience, we have Susana, who will be talking about Colombia's experience, which shows how strong political leadership and inclusive governance can embed health and climate policy, and with that, bringing multiple sectors and communities into forming strategies that are long-lasting and effective. Susana, I know you've been in the hot seat and you've been at the forefront of a lot of this fight, so it would be good to hear from you.
Thank you so much, Lewis. I want to highlight first the understanding that climate change is a public health issue, and it requires the strength of a governance that puts at the center the public sector, which is where the common understanding of a public issue is, with the collaboration and empowerment of communities on the ground. Colombia's health system is a system that is more based on insurance and has been privatized in its governance, creating a lot of inequalities in terms of health attention and in terms of the capacity, relating the capacity to pay to the capacity to access a health system. And on the other hand, it has created a territorial process where actually health services concentrated in the areas where people can pay, which means more a market-based approach. These type of health systems are a disaster to address the threats of climate change. And that is the struggle and the change that the Colombian government has been trying to work out. One first example was when President Petro was mayor of Bogota. In order to try to navigate within that market-based health system, but bring the public health aspects and preventive aspects, a process of territorial health attention was created. And I think this is a first key experience that creates like a piece of the puzzles of the possibility of a governance that addresses climate change. It meant, based on the Venezuelan and the Cuban experience, to divide the territory in families of around 800 families, put preventive health teams to work family by family, but also creating governance structures at the community level to define the social determinants of health that are affecting a population. Link this with data that comes from the territory but goes to databases at a government level, and start following the indicators of public health indicators and how they're doing. The indicators, the system was able to address 800,000 families, 3 million people, and was able to bring down all the indicators of public health. when the pandemic, COVID-19 came, that system, because of a change in government, because this not being part of the public health system in law, was dismantled. So when the pandemic, the COVID-19 shock came, we didn't have something that would have been very useful, which was the capacity to communicate to the people an alert and a situation that they needed to react. And the market-based approach of having the services where the money and people that can pay is created an inequality of attention, which was a disaster, and that was based on lives that actually affected the poorest population and the majority of the population. So now from the national government, we are in the process of having a reform to the health system that will bring back the power to public institutions, that will define the preventive health and public health approach, the strengthening of the capacity of research institutes, and also, which is already having 10,000 teams around health teams around these micro territories all around a country that is very diverse geographically and where climate impacts are differentiation. As Dr. Merawi showed, we could have at the same time floods in a region and a drought in another region and heat wave effects in a city, and all this happening simultaneously. So the territorial approach is very important. But I will also add something that was a learning from COVID-19. The multicultural approach, because populations have different cultural perspectives of approaching health, of approaching risk, and that's why the territorial approach also has to cater for the cultural diversity. In COVID-19, for example, our indigenous communities that do have the constitutional right to manage their own health, justice systems, and territories according to their cultural diversity, use a total different approach from the logic of vaccines and the hospital reaction to COVID. And they use nature-based approach within their traditional knowledge of herbs and of biodiversity. And they were the population with the least impact of COVID of the whole Colombian system without any vaccines. They didn't allow the government to come and put vaccines to the people because on their cultural understanding and knowledge, they use different preventive and community-based methods. There is a diversity of knowledge in cultural diversity that the health systems do not cater when they are approaching shocks and managing emergencies such as COVID, which is a climate change-related emergency. So in this reform, we are trying to take back control of the public health system, trying to take control back of the capacity to prevent and actually to empower communities for reaction to the health issues. I will also add that this has been a conflict, a political conflict, because the people that are involved in the health system do not want to give up power, which means they want to keep health as a business, not as the public human right that is required. And if we continue with this model, it's not possible to address the climate change impacts on health, because that will require data. I will finalize just saying that this approach can go stronger, can go deeper. And how it can get deeper is about the interaction of different agencies within territories, understanding the environmental and social determinants for health, and linking with the climate change scenarios and agencies to have a very strong preventive and systems alert. To finalize, these are some of the key aspects of this governance that will need to be created and that we are working in created in the legal frameworks, financial frameworks, and territorial capacity. First, territories as a specific cultural population governance capacity. Second, financial flows that go and strengthen the public system for public health indicators. Third, interrelationship with data, information that link climate situation with the population, the aggregated data, and the preventive systems. 5, information that is managed directly by communities so they can react to the health situations that are created by climate change, articulation of different agencies in territories, and finally, community power and knowledge in the cultural diversity that we have to be able to react to the very uncertain and dynamic climate change environment.
Thank you so very much, Susana. Speaking from experience, you say a number of things which I really like your very direct framing of climate change as a public health issue, and in it not only leaving it at that, but recognizing the challenge that governments have in terms of capacity to actually interpret this practically. And one thing you also touch upon, which we hear more and more of now, is the role of indigenous knowledge and bringing it into being active in this space. But the last thing I want to quickly highlight for those that have heard me talk before is the dangers of corporate capture of climate change solutions, C4 solutions, corporate capture of climate change solutions, which it doesn't necessarily always work well. And the irony here is that some of the wealthier countries that have had well-established healthcare systems interlinked with climate aspects and now unfortunately dismantling it. So this is not a situation that is isolated to Colombia, I would say, but an unfortunate global direction. And thankfully, there's people like you and others who are trying to reverse directions here. After Susana, our final case takes us to the subnational level, where coordinated governance is often the make or break factor of climate health action. California has an integrated climate adaptation and resilience program that offers a model for how cross-agency alignment, strong partnerships, and deep community engagement can be structured into governance framework and used to scale action across diverse local contexts. For that, I would turn to Nuin-Tara.
Wonderful. Thank you so much again for the opportunity to be here. As was mentioned, I'm going to now speak to the role that the Integrated Climate Adaptation and Resiliency Program in California played in driving better integration of health outcomes, but really as part of our kind of structural governance approach on how we manage climate adaptation and resilience at the state level. I am currently at an organization called California Forward, and so I will also leave this conversation with kind of some quick takeaways and how the work that we did at the state and my experience in building ICARP, or our adaptation program at the state level, is also influencing the work we do at California Forward. So for context and background, I think it's important to start when we're thinking about different governance structures and models around resilience and adaptation to understand kind of the impetus or where the call for new governance systems came from. So in a California context, our adaptation and resilience program, or ICARP, was created through state legislation and state legislative action. And it really came from a recognition both by the state legislature, but also a series of advocates and communities that advocated for the bill to be passed, that there was a gap in how the state was addressing and responding to climate adaptation. And that gap was around how the state governance system was structured. Previous to this bill being established, there were actions being taken by the state around addressing adaptation and resilience, but it wasn't being coordinated or really an aligned process across state government. And what that meant to communities on the ground is that there was inconsistent guidance and information coming from state government, especially around how local governments, local communities, regional governments were expected to kind of plan around climate resilience and also prioritize around investments on risk reduction. So there was kind of growing disconnect between kind of how the state was aligning towards on-the-ground implementation. And it was that recognition that led to the passage of a bill that created our adaptation program. When I came onto the state, this was back in 2016, I think there was also a recognition that in California, our climate adaptation and resilience work was about a decade behind where the state's leadership on climate mitigation or emissions reductions was. And when we looked to that, it was important to recognize that, because when we looked at the difference of why we were behind on the adaptation and resilience side, it was a recognition that we didn't have kind of the institutional structure to really accelerate and drive aligned implementation, both across state government and then also importantly in partnership with our local partners who are really leading implementation of risk reduction and resilience on the ground. And so we recognized, and one of the very first things that we took on as a program was to create a vision, an actual definition of what it is we are working towards when we're talking about building resilience and adapting to climate, so that we across state government had that shared language and vision of what we were working towards. Importantly, and this is where there was a strong integration and incorporation of health, public health and health outcomes as part of our framing on this work, is we developed a series of principles that guided how we were going to work towards that vision of what a resilient future could look like. And those guiding principles were really critically important to setting this framework for how we as the state were going to be approaching and understanding climate resilience and adaptation across state government. The other piece that is really important, and another element where we brought in the public health and health outcomes and view into our work, is we created, and this may sound small, but it actually was really catalytic. We created a definition for climate vulnerable communities and populations. For those who don't know, in California, part of the foundational components of our emissions reductions work was setting clear targets and identifying revenue streams, but importantly, also creating a set of definitions that guided how investments in emissions reductions were going to address underlying social inequities and environmental justice inequities that are aligned with kind of the co-pollutants with emissions in California. We didn't have that same definition of who and how we were defining climate vulnerable communities. And that was creating a lot of challenges for state agencies as we were working to make investments in risk reduction, but didn't actually have the right definition to guide and how to think about who is vulnerable to climate risks and why. And in that definition work, there is a strong recognition around the disproportionate impacts, health impacts that climate has on communities and individuals across California. So that was a really important and foundational piece early on in setting up this kind of governance system and structure. It was creating a vision, the guiding principles in how we were going to work towards that vision, and creating really clear terms and definitions that could guide investments to make sure that they were targeted towards communities and individuals most vulnerable to climate risks. A couple kind of personal observations from that work and why kind of that initial foundational work I think was really successful in creating a really strong governance foundation across state government. One, we were able to, just given the moment in time that we were at back in 2016, before a series of cascading and accelerating climate impacts were hitting the state, starting in 2017 and 18 with wildfires, drought, extreme heat, is we had this window just by luck and chance of being able to kind of take the time for that kind of deep, dedicated partnership building work across state government, but with also our local partners, so that we could build the trust around these foundational pieces that would then guide and be the foundation for the work moving forward. The second is that we came from kind of where we were positioned in state government. Our program was established within the governor's office. At the time, it was called the Office of Planning and Research, and now it is the Office of Land Use and Climate Innovation. And I bring that up because we were positioned in state government to sit at the intersection of different sectors and different agency perspectives. And our role in state government was to bring kind of a long-term planning and perspective to the work that we're doing and think about systems change and systems change and transformation, which brought in public health, but it also brought in other sectors, for example, transportation, emergency response, economic development, that all have impacts to public health outcomes. And we're able to bring those views and perspectives together because of the nature of where we sat. So I think part of why we were successful in bringing public health, but also multi-sector view together is because we sat in state government, that intersection of issues and different agency perspectives. So with that, I will just share a kind of final point around kind of how this work is moving forward and kind of how we bring this perspective around the value and benefit of kind of that systems view to the work that we do at California Forward. The first is a real recognition and understanding that people do not live in sectors, they live in communities. And to drive broad system community change, you have to be bringing those systems and sectors together. And there is such a critical role for both within state government and now outside of state government to have institutions that can be that connective tissue that's bringing system and a systems view to the work that we are doing. It also requires being very intentional about where and how governance roles are set up within our institutions and making sure they have the right kind of levers, but also right positioning in government or outside of government to really drive the type of systems change. And I didn't speak too much about this, but one of the things that is also really important for the work we were doing at California Forward, but also was another component of the work we were doing at the state, is making sure there are the right financial resources to be able to sustain long-term governance systems. And especially in this moment in time, I think that is a really important question that many communities are working through right now, is to figure out how to sustain the financial resources for that long-term governance system that is needed.
Thank you so very much, Nuin-Tara. That is, I really love the way you sort of amplified on the role of a shared vision across different parts of government, but also how you articulate that vision in terms of principles and definitions. So there's no room for fussing around, and how you build not just from the top down, but also from the bottom up. We know that one of the problems of when you start having institutional decay or distrust is a question of legitimacy. And one of establishing legitimacy is making sure that there is buy-in, there is recognition, and there's a sort of a shared destination, both within the government and from the public. This has been fantastic to listen to all three panelists, and I hope listeners are as excited as I am, because of course, there's so much new information coming in here, but also so much articulation on how we can go forward. A common thread is emerging here. There's a durable climate health action depends on governance that is aligned, inclusive, and of course, adaptive. I've been especially interested in how the presented cases frame the link between health and other sectors, especially climate change. The institutional setup that comes from different levels, from subnational all the way to continental, the buy-in from other actors, resources that are allocated for realizing the various initiatives, and of course, the challenges that are faced in the process. We've also heard that from we've heard Now, the form of governance takes matters. That governance takes matters. It doesn't matter whether it's at international level, at local level. The form of governance really does matter. Whether it's anchoring action in high-level political commitment, embedding it in inclusive national policy, or structuring it to work across agencies and communities. So I'd like to pull together all of that and get back to our panelists so we can sort of dig a bit deeper, if you would, to have a deeper conversation to reflect and build on these things that I've highlighted, or other things that you might have wanted to say, but didn't get a chance to. So one of the first things I'd like to have our panelists reflect on is, what is it that got actors to the table? And not only getting them there, but what kept them there? What role did fiscal incentives play? What were the legal mandates or policy windows that allowed for some of the cases that you've presented to be successful, or that make you think they would be successful? I would like to start with María, if you would.
All right, thank you, Liz. Yeah, I think what keeps actors on the table, I mean, this is a really very important question. As presented in my previous slide, maybe let me give you the context here in the continent. We are like 1.4 billion people plus, and but the current vulnerability or resilience capacity is very, very limited and low. And over the last 20 years, over 2,600 public health events happened in the continent, and over 56 to 60% are climate-sensitive disease-related epidemic-prone diseases that happened in the continent and ravaging us across. And this has really scrambled our economy, livelihood across the continent, and causes some conflicts in some places, and also displacement in others, and so on. And this is the context that touches every sector across the board. And unfortunately, with the current existing structure, we don't have really well streamlined One Health coordination, climate governance structure that really addresses this issue. That is one limitation and capacity. The other one is we don't yet develop the capacity to count and account all impacts of climate in health and in health systems in general. And there is very limited awareness on our contribution towards climate change and the way we manage or reduce risks. This is within the health sector, across other sectors. And this really demands all of us to come together. I think we are pinched hard to come together because of the extreme pressure we are facing because of this change. And knowing that one, as Africa Union here, Africa CDC tried to come up with this strategy, leveraging our existence in the political institution where we can really frame the political priorities, policy agendas, and so on. And one of the priority agendas that we set here in the continent is climate change and health. This is not only Africa CDC, the whole of Africa Union, and there are different other departments and dealing with also the Earth Observatory and other departments dealing on climate issues, and we are trying to leverage that existing political environment to put the agenda first, to create this awareness, to mainstream the concept, and to lead, to own to own this agenda first, and own and lead across at different levels across the continent, including from member states, national, subnational levels. So as Africa CDC, we take advantage of being here in the Africa Union. And we set this with what we call it like for strategic areas like policy advocacy and One Health governance that we advocate across the hierarchy or the structure of the African Union Commission, the Africa CDC structure. We also do really partnership with other interested parties, not only within the continent, but across the continent, including civil societies and so on. That is what we call it action-oriented partnerships that we are leading into. And we are, as I said, there is a really limited capacity to account and as well as to count public health impacts of climate change. So we, as Africa CDC, are obliged to develop that capacity and lead continental agenda forward. So that is another area that, as Africa CDC, we are really pushing and also really trying to create institutional capacity across the member states. That is how we are going to empower countries and member states. So this is not only the health sector agenda. So One Health approach across different sectors with equitable collaboration across the environment, animal sectors, and so on, and agriculture, and so on, that we are really pushing to come together. Fortunately, we have this mechanism in the African Union. We call it the task force, One Health Task Force, AMR Task Force in the continent. We are leveraging on all that to push this agenda forward as a continent. So, yes, the extreme pressure we are in is pulling us together and will keep us together until we get it sorted. I mean, that is the pulling factor. And the political commitment that we see from the continent, we are also organizing now soon the Africa Climate Summit, a climate summit here in Africa Union. So with the government of Ethiopia, we will leverage all this to keep and create this policy window, advocate for, and mainstream the concept in general. Let me stop there. Thank you very much, Luis. Back to you.
Thank you so much for that. I also noticed in your presentation that you're taking advantage of international policy processes and integrating health in your NDCs, which I think is it's actually a very smart move. Hopefully, we see fruits of this pretty soon. Susana, you talked all the way from the national government down to communities and even talked about indigenous groups and knowledge. And I'd be interested in this sort of actors that are actually involved here, how you got them, how you got buy-in from them, and what sort of incentives we're providing to get participation.
Well, I say that this has been a political struggle in Colombia. It's a very contentious issue. So it is not like there's agreement on the model. And it depends on the political vision. If you see in a paradigm that health systems managed by the private sector in an insurance model will address public health issues. And there is parts of our society that involve also a lot of stakes, economic stakes in the health system that also even are multinational, because these have become huge health organizations. They take the public money and they provide the services, but they create that fragmentation on the public health aspect. And it creates a lack of governance of government to be able to do its public health duties. So that's one side of the political spectrum. On the other side is more the progressive perspective, where we see health as a human right, and we see health as an issue that has to be seen not only from the capitalistic perspective of a business. So it's not the finances that should determine the action in health. It is a governance, and it's a public governance with the communities. So in that political struggle, the issue is very divisive here. Even trying to pass health reform that will bring this preventive public health issue, although through the debate in Congress, I think there is more understanding and there's more buy-in from all actors, including those private sector actors, which have a very strong capacity to lobby Congress, that the public health aspect and the prevention is clear, because the data is absolutely unquestionable. All the services concentrated where people can pay. And where people cannot pay, rural areas, excluded regions, even neighborhoods in the cities that have less income, then the services are not there. And that's a fact. So so it's been, I think, a struggle, a political struggle. And through that struggle, we've been moving forward slowly but surely. But if the elections are won by a logic of that we should shrink government, that we should, that the private sector can actually deal with the public responsibility, then in this question on sustainability, my bet will be on the empowerment of communities and the governance that you created at the grassroots to be able to become more resilient in times where we are in a very, very dynamic and very unstable political situation. And I'll add one last thing. Another part of the key issue is how you pay these systems. And so you have a very, if you start giving a lot of tax incentives to public sector in general, the public sector will not have enough money to pay for that. And I don't know, I think also in other countries, but in Colombia, we are already changing the demographic profile of our population, and we're gonna be more older population than younger population. That demographic change is happening. So actually social expenditure will increase. Demand for social expenditure will increase. What is the fiscal reform that we need to be able to cater from the public sector to a health system that caters climate change? And there comes again a lot of issues of, in general, how government is established and what's the paradigm. That fiscal reform for a demand of higher social expenditure with climate change and also with the population demographic shift is not a minor issue, and is not a national issue only. And that's why also in COP30 we'll be talking about financial system reform, because we are fiscally, countries like Colombia are fiscally totally trapped with the current rules of the financial international system. This is not possible. And that's another level of governance, another level of structure that we need to understand in this systemic perspective.
Thank you so much. I guess maybe I should have also added in part of my comments, part of dealing with how to get actors on board is also how to deal with interest groups and those stakeholders that are out to block the agenda. There's a lot of conflicting interests here in moving forward with a very integrative approach. And of course, there's very traditional winners, which doesn't always mean it's winners for the broader society. Nuin-Tara, I'm going to turn to you on the question of actors, getting them on board and incentives and policy windows. What would you say?
Yeah, I think when I reflect back on the work we did to build that integrated program that I was talking about, I think there were, and one of the things that I spoke about earlier was kind of where we were positioned in state government and the benefit that came from that. There also were some challenges because we were not, while we had kind of the legal mandate to create the program, we were not a regulatory body in government. We didn't have kind of regulatory levers to be able to dictate what other state agencies do, or even regulate what local implementers and local communities do. So we had to find ways, to your question, to not only bring people to the table, but find incentives to keep them there that were truly rooted and grounded in kind of a collaborative structure. And I think the question that I always asked myself in this process and figuring out what are those incentives to different actors, to different interest groups that need to be at the table, the question that I always asked myself was, how are we adding value to the work that they are already trying to do? I think a lot of governance tables or collaborative tables can be set with a view that the people who are convening are asking those who are coming to the table to contribute something, but they're not always asking the reciprocal question, which is, how are we making their work, their outcomes easier to achieve? And I think, that doesn't always work, but I think we grounded our work in creating this collaborative governance structure with that question always in mind, which meant it was our job as kind of that convener for that, creating that collaborative governance structure, to constantly be looking for opportunities for synergy and collaboration or shared learning across the different perspectives that were at the table. Because they often, specific communities or different sectors who were coming to the table with a very specific agenda, they didn't have the time to explore, what is the relationship or link between public health outcomes and different transportation investments, or public health outcomes and economic kind of development opportunities. We had to take that on and make sure that we were helping them see what those connections were, but in a way that helped them get their work done at the end of the day. So I think that is was a really important view that we brought to the work that we were doing to kind of create the value for people to stay at the table.
What about, we've talked about bringing actors on board, and people typically come with different interests and perspectives, which sort of creates tensions. How inclusive should you be? How fast should you move? And all of this. So I'm going to ask you to reflect a little bit on the sort of trade-offs that you had to make in order to enable coordination, and how you manage some of these tensions. And also reflecting on this, what you would recommend to other sort of at different levels of governance, people trying to set up similar initiatives. Nuin-Tara, do you want to go first since you were last?
Yes, yeah. Yes, I think one thing that is really important when managing trade-offs is to be really clear about what the trade-offs are. In our experience, as we were building out, and again, kind of reflecting on the need to bring our work on climate adaptation and resilience into equal footing with our emissions reductions climate work, was a real conversation, which sometimes was difficult to navigate, that not all climate mitigation and adaptation investments or decisions are co-benefits. We were treating adaptation as a given, that it was always going to be a co-benefit to emissions reductions investments or other investments that were being made, and that's not the reality. So one of the things that we worked on to try to get ahead of kind of how we navigate some of those trade-offs is actually to be honest about where there were co-benefits and where there were real trade-offs, so that decision makers and policymakers could go into those conversations better informed, because early on they did not have that right information to be able to do that. And I think this is an area where, thinking more broadly across kind of the field of adaptation and resilience, where there still is work to do to kind of mature the field and the profession, is to actually be able to understand and quantify what those outcomes and trade-offs are from an adaptation and a risk perspective. And I think actually looking to kind of the health sector, and especially public health, I think is a field that is actually further along in that space. And there's a lot that can be learned from that sector, this perspective, to help inform other policy decisions.
Thank you so much. Mary or Susana, would you have some comments in this regard on sort of trade-offs?
Yeah,
to enable coordination and recommendations.
Yes, thank you very much. With regard to this trade-off in our context here in Africa CDC, everyone is interested and happy with when we present the cases, but in actual sense, there are other competing priorities that countries are really struggling with. So our main mandate and issue is to give those evidences so that they can really do a better decision down the line. But we don't have really actual experience like with this one or kind of that I can give you, but our mandate is to give those evidences and to set so they have a better decision on that trade-offs. But it's everyone has a positive outlook to address climate change and health. And the issue is when it comes to resource allocation, particularly, that is where we are struggling. And I see also one question whether that is even still within our health sector as a separate streamlined budget and so on, but which is not yet there. But that is what we are really advocating for. Yeah, thank you.
Right, thank you. I know that it's pretty much, it's been set up, it's just about a month now, and you're still in the stage of getting things established. Good luck with that. I'd look to learning more and more from you. After Susana, just after you, I'm going to ask Victor or any other member of the, well, Victor, if he would have some questions. But before Victor, Susana, I imagine you would have lots of comments to make on trade-offs and recommendations which we could learn from you.
Yes, I agree that there are some areas of trade-offs that will become specific to the context and the negotiations. I think part of one of those areas will be transitions. So how the transition from a system, let's say here, private with less interaction of the government, not territorial, will go towards a transition of a territorial-based public health-based system, and what are the roles of actors and the power dynamics, like the power shifts that you make. And of course, in this negotiation, the government was going towards a more public-based system, and we have to backtrack to give a role to some of the private actors, intermediaries. And so the transitions, how and the timeline of the transitions, I think is a very interesting field of negotiating trade-offs. Also, the synergies, how you become more effective by creating synergies, which is not, for example, between different agencies, their resources, how that will make them more effective, but also give them more power and voice when the synergies are combined. Sometimes people or agencies, the logic of the government is that who will lead this agenda? And so if I don't have enough power and the money, then but if you create the synergies and everybody has a little bit of distribution of power and see that they can have more effectiveness, maybe that helps. And finally, I agree with Nuin-Tara about co-benefits. I think it's another very important field to be able to negotiate some trade-offs. How, by doing this, we are addressing different aspects of a problem, rather than having so much fragmentation in how we see reality. How, for example, by having this new health system, also the environmental system is being empowered. And what is the co-benefit of an environmental action that we can trace to preventive health and that we can trace to public health? That empowers an agenda that sometimes is not in the mainstream. So that capacity to bring co-benefits also with private actors and communities, I think is a key field of good trade-offs.
We should have subtitled this session, Hard Lessons from the Field. Victor, I know that you're monitoring the COP30 process very closely, and you have some questions. If you want to ask a question or have some comments.
No, I just want to make a comment. As I said, I just came back from Brasilia, where the meetings, in fact, convened by the COP30, but to particularly focus on what they call Berlin Action Plan for Climate and Health. Obviously, governance is a big issue in the discussion, and I really enjoyed the detailed conversation about what needs to be done, the trade-offs and co-benefits. In fact, this whole initiative of the National Academy of Medicine, led by Judy Roden and Andy Haynes, is very much on this issue itself. So let me just read you a passage here and there on the Berlin Action Plan. It doesn't give you a lot of details. Suffice to say, in fact, if this is going to be adopted, it will be at COP30 to say this is where climate health should move. So I'm just saying, reading this in support of what you guys have said. So it says leadership and governance on climate and health with social participation. Given the implementation of adaptation policies by promoting accountability and oversight mechanism established within Ministry of Health or national health authorities. The plan reinforced the full, equitable, active participation of civil society, including women, youth, persons with disabilities, older adults, migrants, and refugees, indigenous people, as well as other groups in more vulnerable situations. It goes further to talk about, as you have said earlier, that health should be embedded in the national determined contributions, a national action plan of all nations. It also goes further to talk about the importance of, in fact, bringing together Minister of Health, Environment, Infrastructure, Education, Agriculture, coordinate with Ministry of Health, empowered to lead cross-sectoral strategies with health at the center. So I'm just reinforcing what you guys have just said, except that at the highest level, at COP30, there in fact will be, in fact, specific statements, if adopted, made around governance, as you've said. Thank you.
Thank you so much, Victor. This feels like learning how to fly a plane while it's in the air. I mean, things are accelerating so fast, and governments are things that we've known, traditional approaches to governance, are needing to meet up so fast. And I'm so happy to hear again and again the word in capacity building here and adaptation, because we're going to need all of this. And there's a few other questions just to the audience and those listening. If you can put in your questions using Slido, we'll see whether we can get to them. And in the meantime, I think I want to take a brief pause from the conversation and invite Ilona Kickbusch, who is founder of the Global Health Center at the Graduate Institute of Geneva, to join the discussion. Ilona, I can see you've joined us. And I know you've been part of so many conversations recently about a shifting global health and development landscape. How do the governance dynamics we've explored today resonate with what you're seeing more broadly? And what lessons should we, as the Commission, carry forward into our work to advance health-centered climate actions? Ilona, I'd like to hear from you.
Thank you very much, Louis. This has been really exciting to hear from the speakers, and of course also looking at some of the background. As you know, I've been involved in public health innovation for quite some time. And what really intrigues me is that so much of what is now being discussed of the interlink between environment and health links very much to a tradition of health in all policies, or as we called it, healthy public policy. And many of the experiences that have been expressed here with, co-creation, with a whole number of other things, have actually been looked at in great detail and analyzed in the health in all policies literature. And I think there is a coming together with a new power of trying to indicate that we just cannot create our health without concern of a whole range of determinants of health. But at the same time, I think there is a very significant shift going on. We, in a way, looked at the environment as a determinant of health. And what we now actually see that we can no longer promote or protect our health without adopting a planetary perspective. So I think the integration is much bigger than we have in our determinants of health literature in public health or our thinking there. And therefore, I think that is a really new, critical, and historical challenge of redefining what public health actually does and what it is about. Now, that redefinition, and we heard it from our speakers, is happening. As we discuss it here, people are living it, expressing it, inventing it at so many different levels. In communities, they're rediscovering the indigenous knowledge, as we heard, or finally are being heard as indigenous people who have always integrated the planetary with human health. They have never seen themselves as separate, as we have in a Western rational conception of ourselves and of the world, when we thought we had to dominate the world, not only the environment, but the world as a whole. And now this new thinking is moving forward, and that's why it's so important that a lot of the innovation comes from what we sometimes call the global south. And that is why it's so important of COP being in Brazil. It's so important to hear the examples from Colombia, but particularly to hear that Africa is taking such a strong lead in relation to the environment and health and to this planetary perspective. What's also really exciting is that what we've heard from the speakers relates so much to the recommendations of the Lancet Commission on One Health. The report of the Commission was launched just about a week ago, and many of the recommendations basically read nearly word by word what our speakers have said. And that means, and I think this is really important, that a consensus is being built. And this consensus is not only in, let me now call it the narrower health community, saying, you know, we have to work with the environmental community, but that the environmental community, the animal health community, and many other communities are starting to understand that this is a common integrated agenda. And I think even though it hasn't been mentioned here, but that the whole aspect and the use case of food systems, and I'm thinking because One Health obviously includes agriculture, is an absolutely central element in this. And where, you know, it is not only the issues about heat or climate or that we relate to in a bigger way the planetary, but it is really the impact of the food we eat and the plants and the animals we live with and how we experience nature. And I think it's very worthwhile for this commission also to look closely at what the Lancet Commission put forward. And there are two things that they particularly highlighted, and that is to advocate a socio-ecological paradigm of health, public health, and the environment, and an economic shift. And that relates to what we heard from California. We have to create a vision. There's, you know, a lot of incredibly practical things around this interface, particularly of One Health, the different sectors, the health in all policies, the environment in all policies. But there needs to be a vision, and particularly in a world that's so crisis-ridden, the need for such a vision of public health is very important. And that includes our understanding of the state and what the state should be doing. We heard it from Colombia. And I think here again, and the important role of the state, you know, in California, the important role of states in the African Union. And that in a period of transition where the economic models and the geopolitics is shifting so radically, I think part of our governance discussion is, you know, how we see the state, the government agencies, the governance structures driving this agenda. And I think it's worthwhile to look at the discussions of what is called a mission-driven governance. And I believe the mission-driven governance has to very much be around the issue of planetary health and the interface of the environment and health. We have a lot working against us. We've heard it. There is a dominance of vested interests. There are, different political interests. There is a polarization in society, and a lot of the discussion that seemed to be so well on the way even 2 or 3 years ago has had a drawback, which is why one governance level we didn't discuss until Victor came in, and that is the global level, is also important. That COP gives a message that member states agree to, that there is a responsibility of governments to ensure the health of their peoples and to ensure the health of the planet. I think there's one issue that wasn't mentioned, because we did speak about, the data that is necessary also to convince policymakers, the kind of data we have to gather. But I think there is one big difference that we've started to experience in health with the COVID-19 pandemic, and that is also a challenge within the environmental debate. And that is that we have a new dynamics. We have a new non-linear dynamics in ecology. And, this is where the feedback loops start to be of a very, very different nature. And we understood in COVID-19 policies that people didn't understand that trajectory. They were still thinking, of the normal way that things grow. They didn't consider things such as tipping points, cascading risks, or other such issues. And I think as we move this planetary health thinking forward, we have to, and capacity building was mentioned, we have to understand this new kind of measurement, which also brings new levels of accountability in. And I think we need for health, we need similar models as we have in the tipping point discussion of the environment. Let me just close with highlighting some of the design principles that were also mentioned by our speakers, and indicate that, as we move forward, we have to be very clear about these design principles for integrated climate and health governance, and that they are systemic. They are not dealing just with one issue here and one issue there, and they will come together, and yes, we'll be able to define some co-benefits. No, we really need to be clear about these design principles. And it starts out with the values that was mentioned by the speakers, the values of equity and justice, but also the value of public systems. Public health isn't just a word. The public is central to public health as a public system that ensures population health and that increasingly must ensure the health of the planet. That obviously a design principle is systems integration and policy coherence, that we need the multi-level governance, that we absolutely need participatory and co-creational approaches, that we need adaptive designs, particularly if you go back to my point about the new types of trajectories, we need to have adaptive governance. And that is something that is very difficult in systems that are subject to election cycles, to polarization, and other issues. And therefore, the agenda setting and the framing is absolutely critical, and we must not underestimate it. We need a narrative for the population. We need a narrative for the discussions with the many stakeholders. And if we are not clear about that narrative, we are not going to win the game. So I think the examples we had were absolutely fantastic. I think we will now hear from that other element that we need, the regulation, the norm setting, the legislation, and of course, the financing. And I do think that this bringing together in a totally new way of a planetary perspective of people and their environments as an integrated system themselves will be the way forward. Thank you very much.
Thank you so very much, Ilona. And now I regret not waiting for you to wrap up the session instead of me, because you've captured it so elegantly, and you've also put forward, very importantly, to the Commission what they should think through when we're putting together the action plan going forward. But Ilona, I'm going to ask you if you can be really, really quick, because we're probably running out of time, and I'm going to press you on this, given your experience on this topic. Governments are struggling with all sorts of issues right now, they would argue. And why prioritize the intersection of climate and health over all the other things that they're going through?
I didn't hear that question. Could you say it again?
Several governments would argue that there are so many issues on the table: economic competitiveness, security issues, and resource access to resources. And the issue of health and climate is just one of several. And why should they prioritize this?
Well, they should prioritize it because their populations need to survive. Their populations need to contribute to the economy. Their populations should not be creating enormous costs for a healthcare sector. I mean, a government, if we're idealistic for a minute, a government is there to serve its people. And if it doesn't prioritize elements that ensure, the lives of these people and their well-being, as we developed, for example, in the WHO Commission on the Council on the Economics of Health for All, together with Mariano Mazzucato, if the government doesn't fulfill its most essential function, the well-being of its people, which now includes the well-being of the planet, then it doesn't fulfill its functions. And, over the last 20, 30 years of discussions on prevention and health promotion and everything that needs to be done, we see that governments who have not made those priorities have not been able to get well through the pandemic. They have increasing healthcare costs that they cannot manage. They have, enormous problems with their workforce. They have issues, around older populations. And one of the really dangerous things we see right now, also, for example, in my own country, Germany, is that people are trying to break these agendas by juxtaposing a social agenda with an environmental agenda and saying if you invest in the environment, then you're not going to get your old age pension. And I think, there's no trade-off here. We need to be clear in our narrative that they need to come together. And of course, governments who don't want to increase taxation of their big business or their profit-making companies will say there is no money to do that. But that is why, this must be a social movement, and it must have a clear narrative for the population that if we invest in ABCD, we are not taking away your childcare, your education, or your health service.
Thank you so much, Ilona, for that very clear response. I am now going to invite our panelists back, and I have a few questions. Actually, I have so many questions coming in from the public, but I'm not going to go through all of them. I'll select just a few, and if you can be very succinct with your responses, that would help us pick on quite a few of them. one of the running threads here is the economic system that frames resourcing for meeting our health, for sort of holding up our healthcare system. And we've had specific examples of how private interests are derailing public interests through sort of access to the government and all sorts of mechanisms, which I'm not going to list here. But we also know that corporations and the private sector do some good, and they can be very effective when made a part of a positive vision. So I'd like to ask the panelists, do you have any guidance for integrating the private sector into health and climate positive governance? Whoever feels they can respond to this first, I'll leave it up to you. And while you're thinking about it, subsequently, I'm also quite interested, or at least someone else is also interested, to hear from Mary whether the African health budgets and programs now reflecting a climate change resilient investment has specific line. I think these are interrelated. The second one is more specific to Africa, but the first one on guidance for integrating the private sector into health and climate positive governance is a little broader. So whoever feels ready, or maybe I could, Susana, do you? Okay.
Yeah, I'm happy to.
Like you're ready to go.
Yeah, I'm happy to go. I think, one of the examples that I would give is around there are opportunities to kind of leverage and bring in the private sector as a kind of positive actor or stakeholder in what we've been talking about today. And one example, and actually I think starting the conversation as an avenue in it around climate impacts can be a really helpful way in on these conversations. So, for example, in a previous role, when I worked at an insurance company in our climate work, we actually were looking at ways to better drive alignment across public and private sector actors and partners towards public outcomes and public good, the public good around health. And we actually found a lot of traction of starting with, and actually this goes to your last question that you asked, Ilona, around kind of how, around how we actually drive the change that we need, is we were looking at what it means to be resilient. And we cannot be resilient if we are leaving communities behind. And I think employers understand that their employees, or they can understand that their employees are impacted by climate impacts. And they also have an opportunity to make sure that their employees, especially around, we were actually able to engage through conversations around health benefits and health insurance and understanding what type of benefits their employees needed specifically to deal with the impacts and also the social determinants of health that their communities were facing as an employer in a community. And they understood that their business was dependent on the health of their employees. And so we were able to use that avenue into a conversation to not only engage with them around what type of health benefits their employees needed, but also that piece of what is the community where their employees are living? What are the determinants of health that are impacting them that are beyond just their health coverage and their health benefits and their health care that are impacting them? And we were able to facilitate some interesting conversations around public-private partnership and investment, for example, in mobile health clinics that would be outside of the realm of kind of a typical employer health benefit plan, but they understood that connection. So that was a long answer, but I think there are some interesting ways to kind of structure the conversation. Again, going back to the point we were making before around governance of where there are opportunities to provide and facilitate kind of shared collaboration and partnership towards broader outcomes.
Thank you, Nuin-Tara. Susana, would you want to go next?
Just one very small comment. For me, the issue is, of course, a private sector is in health systems as service providers, but the critical question is where the power of the governance lies. And I think we have to put public systems and governance to have enough power to be able to govern the interaction between the private actors in a health system, the communities, and with this very difficult environmental change. Otherwise, and in that governance, where they have a participation, but they follow the guidelines of public health authorities and the work with communities, they can have a very proactive role in innovation, technology, participation, of course, what they do in the health system. But what it's now not right is that is the capital, the money that is determining the health systems and attention, leaving the public governance, or at least in my country, with less power. And I think that creates something that is not healthy, including their political capacity to influence public decisions. I think that's where we lose it. And so everybody has to be in the right place and in the right role so that we can move forward. But that's when, and this is basically what defines the crisis, which is capital against well-being and life. And this we see also in the health systems, is the capital logic, the capitalistic logic, the profits that are defining the decisions, and not what we need to do as society to deal with this climate crisis and their health consequences. And that's, I think, where the political struggle lies.
Thank you, Susana. María, if you also want to comment on the other question that was directed at you.
Yes, thank you. Thank you very much. Just
and to make it succinct, in the interest of time, I'd appreciate it.
Yeah, sure. Thank you. So maybe on top of what was reflected by Susana and Terry, I just want to mention this one. I think while we are advocating health in all policies and so on, as well as climate and health, what is driving the private sector is always profit. And we need to find out what are those investment areas in this realm that can really come in and contribute positively towards. I think that is a question that we all need to also think about and engage them. Like for solarization of health facilities, for example, can be outsourced to a private sector so that they can come in, positively contribute towards, while we are really thinking of these other processes. Yeah, it is profit-driven, it is challenging to be taken over by, but we can also do some thought around that. So currently, there is very limited, if not none, specific streamline for climate and health in the budgets of governments in our region, because there are still other priority competing parts, and also mainstreaming the concept is not yet there. That's what we are now pushing as agenda in Africa. Thank you.
Thank you so much. Ilona, does the question of private sector participation, does it chime with what you talk about from the Lancet recommendation, the Lancet Commission's recommendation on economic shifts?
Yes, because the Lancet Commission took up the idea, of course, that how do we measure progress in our societies, and took up, this very broad discussion on that GDP is not really a measure of success and is not really a measure of well-being. And therefore, there is this discussion of, a society that invests differently. And we've discussed areas of such investment, and a society, and this is where the narrative is so important, a society that defines its success differently. And of course, equity is a major dimension of such success, that, a high GDP which is the case in a number of countries, but an enormous discrepancy and inequity in societies is not really a successful society. And I think that is where the public health community has consistently raised its voice, where WHO has, and the United Nations system. And therefore, I do think the involvement of, even though multilateralism is being challenged right now, particularly through one country, the importance of continuously trying to push the agenda of what we as human beings actually want to achieve as a good society is really critical. And the sad thing is actually, if I stick to the private sector for 1 minute, we know it from a number of major food companies, etc., is that where the companies and the CEOs of those companies actually wanted to act more responsibly, they were kicked out. And who were they kicked out by? By the financial investors. And so this is not just an issue of companies. We've got to be very clear that in many cases, and Nuin-Tara also indicated that there are very well-meaning companies. And I think particularly, again, in my country, so many middle-sized companies. Germany is defined by very responsible middle-sized companies who play an enormous role in the community and are willing to move forward, but are dependent to some extent on the big financial investors, on equity firms, etc. And it is not the private sector, it is increasingly the financial system and the investors that actually drive the politics that are destructive to health and the environment. And I think that differentiation is very, very important.
Yeah, we live in tested times, and somewhat we're in the process of rethinking all that we know about governance and public health, which makes it very interesting. And thankfully, there's people like you who are exploring every possibility of moving forward. People like you who are thinking not just of now, but also of the future. And I have to say how much of a privilege it is being sort of moderating a panel and learning from all of you. I hope the audience got at least half of what I got from you. In that case, we're all the richer. We're coming off a time when we treated the environment as separate from the social, and we're quickly learning that the environment is the social, and we're not going to address environmental or climate issues without looking at the social tensions that we see building in our society. The paradox here also being, or the irony here being, the more we talk about crossing 1.5-degree red lines or limits that we've set, the narrower the threshold for addressing those or achieving those social goals that we've set for ourselves. In this respect, I cannot think of any other area than health to hold all the strands together and to drive it forward in a way that benefits everyone. Everyone has some kind of a health-related aspect, right? So I thank you so much for sort of taking the time to have us listen to you, to showcase what you're working on. María, Nuin-Tara, Susana, Ilona, thank you so much. And I thank the audience very tremendously for being with us through all these hours. Hopefully, this gives us some impetus for moving forward. Thank you.